What's up, everyone? And thank you for tuning in to another episode of Mental Mixology. I am your host, Elex, and for a little over 3 years, I've been putting episodes out on Mental Mixology, and I've never kind of dived deep into my own mental health journey story, per se. But today is where that changes. We are sitting down with Megan Keys to go more in depth about PTSD, which is post-traumatic stress disorder for anybody who is not familiar with it. Megan is a clinical psychologist with over 20 years of experience. She specializes in gold standard, evidence-based psychotherapy for adults. Her area of expertise is in implementation and dissemination of first-line treatments for adults with PTSD, namely cognitive processing therapy, which is CPT, and prolonged exposure therapy, PE. And as a member of the Upward Behavioral Health, she offers the leading therapies via telehealth for adults with PTSD, prolonged or complicated grief, anxiety, and depression, as well as couples experiencing relationship distress. Now, Megan, I'm super excited to have you on here today. How are you feeling?
Thank you so much for the invitation, Alex. I'm a little nervous. As I said, this is my first time doing a podcast, but I always so appreciate the chance to chat about this topic and hopefully shed some light on it. So I really, really appreciate you having me here.
Yes. Now, and just, I don't know, because I kind of went through a little background of you just now. Do you want to just kind of share with people like what you're doing right now and your involvement with mental health and the mental health industry?
Certainly. So I would say, most of my career actually was with the VA, with our Veterans Hospital system. I was with them for a total of 26 years. I just separated from the VA last summer, and the bulk of that work was in the area of PTSD. So it was working as a PTSD therapist in various PTSD programs. And I also spent 16 years with the National Center for PTSD, the Prolonged Exposure Therapy Training Program. So I provided training and consultation to VA therapists learning that treatment. Currently, I really have kind of three probably primary domains or primary areas where I work in the mental health. So I'm a clinical psychologist and a member of Upward Behavioral Health. We are a specialty private practice, and we offer the kind of the leading evidence-based therapies for a range of different type of mental health issues. And so that's sort of my clinical arm. I'm also adjunct faculty with the Brown School at Washington University in St. Louis. And there I teach graduate coursework, and I also teach a lot of continuing education courses for our professional development program. So that's where my foot kind of stands firmly in academia and teaching. And then finally, I do a great deal of public speaking. So that's something that I've really started doing over the course of the pandemic, doing a lot of advocacy and public speaking on the mental health impact of the pandemic. And that has just segued ever since into doing more public speaking on a wider range of topics. So, like I said, those are kind of the three main things that I'm doing at the moment.
Amazing. That's crazy enough. I say this because I tell so many people, especially people my age, LinkedIn is a really great resource. And that is how I found Megan. And I saw her background and I was just like, we have got to message her. We have got to, just start chatting with her. So that is also just kind of a life tip for anybody. LinkedIn is such a great resource, not even just for your career, but your personal life and networking and meeting people. So yes, shout out to LinkedIn for helping me connect with Megan. But so really today we're going to treat my story as a case study. We're going to go through it, and as we talk about it, Megan is going to be able to, like I mentioned before, give us a understanding of why things are happening, maybe information or education on symptoms. She's going to help us navigate through this case study per se. So really, I wanted to do this too because I think a lot of people can take away from mental health education when you hear real life instances, because some people can relate to it, and I think that can really help hit home. So that's kind of what the goal today is to do. For me, my story in mental health started when I was a senior in high school, because I kind of was telling Megan about this before. I was the type of kid growing up, I was super confident and spunky and adventurous, and I kind of flew by the seat of my pants, and it did really well for me in life. And the summer before my senior year of high school, I was living as I had normally done, and within a 2-week span, I had been sexually assaulted. And then 2 weeks after that had happened, I got hit by a drunk driver. And it, to this day, it just kind of puts a pit in my stomach talking about. I'm very proud of where I've gotten to now. But, that spunky, adventurous, bubbly person going through those things, my whole life changed. My personality changed. And I think my family could see it, my friends could see it, but there was no explanation around it because everything happened to me and I put myself in this little bubble because I thought if I keep myself in this little bubble, nothing can hurt me, nothing bad can happen. And from there is kind of when my lifestyle changed a lot, which I don't know, Megan, is that normal for people to do? To just kind of be very reclusive from friends, family, and the outside world?
Yeah, yeah. So I would say, well, I mean, first of all, Alex, thank you just for kind of sharing that part of your story and how much you noticed this kind of change in yourself after the trauma. And I think what you really highlighted is an excellent example of what happens for a lot of people. We know that following a trauma, there are kind of a set of really common trauma reactions that most everyone experiences.
Mhm.
And those can include things like having a lot of unwanted thoughts about the trauma, feeling
Mhm.
anxious, having trouble sleeping, maybe avoiding certain things or places that remind you of that trauma. But
Mhm.
what we see is that for many people, over time, like in the coming weeks and months, a lot of those symptoms and reactions sort of start to dissipate. For some individuals, though, they end up continuing on and becoming kind of even more severe to where it can really start to impair the individual. And that's usually what we see then as our development of the PTSD symptoms. These trauma reactions that don't really dissipate over time, they just kind of grow and become stronger and develop into PTSD. So when you spoke about the piece of isolation, one of the really hallmark symptoms of PTSD is what we call avoidance. And this is where the person usually will work really hard to avoid any type of reminders about that trauma, whether it be internal reminders like thoughts or memories or feelings, or external reminders like places, people, certain sounds or smells or things that are associated with the trauma. And so that idea of following a trauma, and if a person starts to develop PTSD, that their world starts to become a bit smaller and smaller because of that working so hard to avoid these things that remind them of the trauma. That is absolutely something that can happen. And it's actually very common within the context of PTSD.
Okay. Well, I was gonna say, because that is something that did linger for a while in my life, because senior year happened and I was still in the comfort of my own home, with my parents. And granted, it was not something, none of it was anything that I wanted to talk about. Granted, the car accident was really the only thing people knew about. So that was the thing. I really just kept it all to myself. And I'm like, we're just going to keep living life and see what happens, especially because this was in 2016. And we've evolved so much as a society and how much we're talking about mental health. But at that point in life, I mean, I didn't know what to do. I didn't know where to go. I didn't know what the resources were. So I just kind of dealt with it. And then, kind of moving forward, I graduated high school, I went to college, and I only went about 30 minutes away from me, which I think, when you talk about kind of just self isolating, when we mention that, I was dead set on going to Georgia Southern because I'm not originally from Missouri. So when I wanted to go to college, I'm like, I'm getting out of here, I'm going back to Georgia. And then after all of that happened, I went 30 minutes away from where my parents were. And I'm not kidding. If you would have told me a year before that happened, that's where I was going to school, I would have laughed because I didn't want to be that close to home. So, I mean, do you think that could even change like a big life decision as to that? I don't want to say extreme, but.
I think it's absolutely possible because I think the thing that's so important for people to remember is that following a trauma, when most people will experience a range of these trauma reactions,
Mhm.
those reactions, there's nothing aberrant or pathological about those. Those really are normal reactions to a very kind of extraordinary circumstance, the trauma.
Okay.
Trauma is uncontrollable, unpreventable, and unwanted. It is a big life event, and it
Mhm.
often results in big reactions that have a big impact. And so
Okay.
the idea that exactly like you said, over the course of after experiencing these traumas, and I'm guessing based on what you're talking about, some of the different reactions and symptoms that you experienced, the fact that it could really change your trajectory and even some of the major life decisions you are making absolutely kind of falls under that umbrella of a way that we could see PTSD impact a person.
Okay. And so to kind of continue with it, I went to school 30 minutes away from home. And the first semester, my parents, just because I had worked jobs in high school, I'm a busy bee, I like having a lot going on. So my parents at first were like, just go to school, get your feet wet, get a bearing of everything. And that was, I'm not kidding, probably one of the worst couple months of my life just because I felt so alone. Nobody knew what was going on with me, and it would be to the point where and I had great people around me. That's what was so hard is, like, I had a great college roommate, I had great suite mates and people around me, and we would get ready to go hang out with our friends on a Friday night. I would have, my makeup done, hair done, all ready, and then I would get this just weird feeling of we're not going to do this. And I'm not kidding. I would be all done up and I would look at my friends and be like, I don't really feel good. I think I'm just going to stay back. And they were great because they weren't, mad at me or held that against me. They were very understanding, but it sucked, not really knowing how to explain what you were feeling. And so that, like I said, was a really hard time of my life because I went to school and just hung out in my dorm room, which I don't know if you have anything to add because we still kind of are on the self isolation part of it, but I, I don't know. It's almost like in those moments when you think that you're doing better, it just kind of all goes away so quickly, and you're like, I thought we were good, and now we're not.
One of the things that I'm curious about, Alex, when you talk about this, because you had mentioned just a bit earlier that a lot of these changes, it kind of was this idea of kind of keeping yourself in this little safe bubble. And
Yeah.
I was just curious for you, like, as you were experiencing all of this, did that feel like that was a kind of driving force that you were aware of? Is that, I don't want this type of thing to happen to me again. So if I don't go out to the parties, or if I don't go to the game, or if I don't put myself in certain situations, then I'll be able to protect myself so that I don't experience another trauma.
Without a doubt, because I think that was the hard thing is when it's like the day of the party, you're all talking about it, you're excited, but then like the more you think of it and the closer it is to like go leave, it becomes more real. And you're like, okay, like we're getting closer to the period of time where I'm going to lose control. Like that's what it feels like. You're losing control of the situation. And that was what was daunting to me, I think, was we're here with our friends right now, but the second we leave, like, I don't know what could happen. So, yeah, I think you definitely have a point there.
Thing is, when we think about when those trauma reactions start to kind of morph into PTSD, when they don't start to dissipate on their own, there's really kind of four key categories of PTSD symptoms. There's what we call our re-experiencing symptoms, and that's really the degree to which this trauma that happened in the past is still very much in the person's present life. Whether it be like unwanted thoughts and memories, bad dreams, sometimes getting like emotionally upset or even feeling like physically or physiologically upset or aroused if you're exposed to something that reminds you of the trauma. There's
Yeah.
our re-experiencing symptoms. Then there's our avoidance symptoms, which we've been talking about a bit already. And for a lot of survivors, avoidance is really the best way that they have found to keep those re-experiencing symptoms at arm's length. And that's one of the reasons why avoidance is such an incredibly powerful symptom, because for so many people, it's with PTSD, it's kind of the one way they know to protect themselves, kind of with the belief that if they just avoid these things that feel unsafe or feel uncertain, they'll be able to prevent a trauma from happening again. And we also know that avoidance symptoms are one of the key things that really maintain PTSD. And it is actually one of the key things that some of our most effective treatments tend to really target are those avoidance symptoms. So the
Wow.
avoidance, exactly what you're talking about with the
Mhm.
self-isolation, the opting out of some types of social activities, not
Mhm.
really sharing or discussing the trauma with other individuals, those are
Mhm.
all perfect examples of the type of avoidance symptoms a person can experience.
Okay. Well, I was gonna say, yeah,
Absolutely.
definitely, yeah, fitting that mold well.
Yes.
Well, and that was the thing, so I had went through my first semester and I realized that I was getting nowhere. I even thought about dropping out of college. That was the thing. Like in the spot I was in, I'm like, I don't even know if like I'm where I should be. Like, am I not happy because I'm not doing what I want to do in school, which I was doing my gen ed. So that didn't make sense. I'm like, I'm learning the general studies right now. It's not really affecting what my whole life trajectory and education is going to be. But I did question a lot of things. And then finally, second semester, I got a job, which actually two jobs. So I basically filled all my free time with working and going to school. And I will say, I thoroughly enjoyed it. Like, I had a really good college experience because I made friends and family with the people I worked with. In my opinion, I was so busy, I didn't have time to think about my thoughts and my feelings because I either had a quiz due or a shift to make, or I was barely sleeping too because I basically would work at a restaurant and then work at a bar, go to bed, go to class, aside from the weekends. So, is that something people can do as well when they're dealing with PTSD? Is like overconsume on extracurriculars to be able to like drown out the outside noise?
Absolutely is, Alex. And it's another really great example of those avoidance symptoms because avoidance isn't always just, staying away from certain things, or we get ourselves into a situation that's now feeling uncomfortable or unsafe or reminds us of the trauma. So we want to escape it or get out of it. Another type of avoidance behavior that happens a lot is that keeping myself so busy, I really don't have any downtime or quiet time. And that's a good thing because as long as I'm very busy and I'm preoccupied with things and focused on things, a lot of those re experiencing symptoms, those unwanted thoughts or memories about the trauma, those unwanted feelings, they don't always have the time and the space to pop up. And so
Yeah.
that just busyness can absolutely be another type of avoidance that a person will rely on very heavily because, again, it's an effective way of trying to keep those kind of re experiencing symptoms at bay.
Nice. Well, and I do want to ask this too, just because with me having symptoms of avoidance, for people that are dealing with PTSD that might be dealing with other symptoms, what are some of those and what might they look like?
So in terms of like our symptoms of PTSD, like I said, there's sort of four categories. So we've got our re-experiencing, how the trauma is still very much with the person in their present life. We
Mhm.
have our avoidance, which, like we said, is kind of the best way the person has found to really keep those re-experiencing symptoms at bay. The other two clusters of symptoms, one is that a lot of individuals with PTSD find that after the trauma, they just experience a lot more negative thoughts and negative emotions than they did before. And when we think about trauma, like kind of classically, we always thought of like anxiety and fear, and those are the key emotions that are really tied up in trauma and PTSD. But over the past several decades of research, what we're finding is that yes, those can be a key part of it for many people. But there also can be very strong and significant feelings of sadness or guilt or blame, and in some cases, anger. And so we really do see kind of a range of negative emotions. And for a lot of individuals with PTSD, they just notice that they have a lot more of those negative emotions after the trauma.
Yep.
They also notice that they have a big shift in kind of some of their most basic beliefs and the way they think about the world. And so, what we know is that within the context of trauma and PTSD, one of the other key factors that really maintains PTSD and the symptoms, along with avoidance, is what we call some of these really unhelpful or inaccurate beliefs that an individual with PTSD often develops after a trauma. And what we see is that because trauma is such a major life event, it really can shift the most basic ways that a person has viewed themselves, other people, and the world around them. And some just classic examples of that are following a trauma for somebody with PTSD. They may come to really view the world as a very dangerous place. They may view that people, just in general across the board, are not trustworthy and no one can be trusted. Many people with PTSD, it really impacts their self image and how they think about themselves. They may feel that they're, incompetent to handle difficult situations because they weren't able to predict or prevent that trauma. They may not trust their judgment anymore or feel like they can make good decisions. And those are all examples of the types of negative thoughts that individuals with PTSD tend to have and have a lot more of following a trauma.
Wow. Okay. That's
Yeah.
really good insight. Really, really good insight.
Yeah. And did you, Alex, I was just curious
Mm.
because I know you talked about, having kind of gone from being the really happy, bubbly, active to
Mm.
being a bit more a bubble and then sort of coming out of the bubble to a degree with work and classes and things like that. Did you
Yeah.
feel like you noticed a shift at all just in the way you kind of viewed yourself or the world around you?
Definitely myself. Just because my parents always taught me, they instilled confidence in me at a very young age because I had hearing aids and glasses growing up too. So, just things that were different from other people, they just made it very apparent to me that like I need to love myself, like God made me a certain way. And that, I think when you're young, can be so much easier to be able to grasp and agree with and understand. And then the older you get, that can change. And then you sprinkle the PTSD on there, and then it's like, that's honestly too kind of why I think I kept myself busy and just kind of going because, and I'll use this as an example. So I worked at a bar for a really long time. So in college, I was a shot girl. I walked around with a tray of shots and had people buy those. And then once I turned 21, I bartended. And I always tell my friends, because now I don't bartend anymore, I I have a hard time going to bars just because I'm so used to being the bartender. So it was like I was a robot. I knew what to say, I knew how to do the customer service, but it's like interacting with people on the flip side of that. Like to this day, I'm still not like super confident in doing that. And I am gaining confidence in different aspects of my life, but I definitely think the way I looked at myself was really impacted by everything just because I didn't think I could do much. I didn't think I was worthy of much. I just kind of went through the motions of things, and I don't know. It's harder to explain, but I definitely think my self-worth changed a lot after that.
It is again something that we often see following trauma and in PTSD. And you, actually, I think for a second, you said something that made me, that I wanted to jump on, and now I've forgotten
Yeah.
it. It was when you were talking about kind of when you were working in the bars and you kind of knew the routine of being a bartender
Yeah.
or shot girl and kind of the going through the motions.
Yeah.
I think that's something that I've had many clients over the years speak to is that idea of after the trauma, I knew something changed. Like I could tell I
Mhm.
was different, but I really thought it was, this is just kind of who I am now. This is just sort of
Yeah.
who I am now because of this trauma and what I experienced. And they would say, like, I still know enough that when I'm in certain social situations or certain places, I know how to go through the routine. Like, I know
Yeah.
how to go through the motions. I know what I'm supposed to do.
Yep.
But and externally, people may view me as not that big a deal,
Mhm.
like still doing the things she used to do, or more or less. But
Yeah.
internally, it feels completely different. And these situations
Mhm.
that may look really familiar and that I've been in for years, coming back into them now, it feels like a different world on the inside. And I just wasn't
Yeah.
sure for you that that's kind of a piece of what you were speaking to was I'm going through the motions, but internally, it just didn't feel the way that it used to or the way that you would have wanted it
Spot on, without a shadow of a doubt.
to.
Because
Okay.
and that's the thing too is it's almost like you like mourn the person you used to be too, which sucks because like even now, like you always think like where like would anything be different, Like especially in your personality and what you do, but you do appreciate what you've been through because like I don't know, I don't think I would be the person I am today without going through those things, but it is hard to yeah, like I said, kind of like mourn the old person or the person you used to be?
You raised a really key point because even though I wouldn't say that this is something that is necessarily identified as like a hallmark symptom of PTSD, I would say that it's something that I've seen so often over the past, 20 something years. And that's that in the context of trauma, there's always some type of loss that
Yeah.
we're dealing with. right? I mean, sometimes the
Exactly.
trauma does involve an actual death or a loss of a loved one or a loss of something, but other
Yeah.
times it's a loss of innocence. It's a
Mm.
loss of a sense of safety. It's a loss of a sense of control. And so
Yeah.
I think, what you speak to about that piece of, gee, there is that part where you wonder, what would I have been like had I not been through that experience? I think that is speaking to a legitimate loss that a lot of people experience following a trauma. I think the flip side of that is what you also touched on is that, in the context of trauma and PTSD, there actually is an entire area of research now that we call post traumatic growth. And what it's actually looking at is in the aftermath of a trauma, certainly not
Yeah.
during, but in the
Mhm.
aftermath of a trauma, what are some of the strengths and lessons that a person has gained that they're able to kind of use going forward in their lives in a positive way? So I
Mhm.
would say, there's definitely this balance. There's legitimate loss and grief around what happened and how that could have impacted a person. But
Yeah.
there also can be a piece where people also can really get in touch with and find that they have gained some real strengths in learning to navigate the aftermath of the trauma in their life.
Without a doubt. Without a doubt. And with that too, so after dealing with the situations I had and as time went on and I was working, those were the moments, after it had been a year or two after, the things I had gone through, that's when I started seeing, and I will say, I think with things you go through in life, anxiety and depression can come about. But do you think the unresolved things I had gone through, do you think that would add to me dealing with anxiety and depression to a higher degree? Because those were the times where I never would have said I had anxiety or depression before college, and that was when I was really being impacted by it, in my opinion.
Yeah. So, no, you raised a great question in terms of when we just look at trauma exposure. If somebody experiences a trauma, kind of what can that end up resulting in terms of
Uh-huh.
changes in mental health? So, PTSD is the thing that, I guess we most often understandably associate with trauma. But the
Mhm.
truth is, research tells us within the United States, about 70% of US adults will experience at least one trauma in their lifetime. So
Wow.
trauma isn't rare, it's actually
Yeah.
fairly common. However, we know that out of that 70% that experience a trauma, or at least one trauma, only about 6 to 8% end up developing PTSD. So we do know, like I said, for the vast majority of individuals, they kind of naturally recover from that trauma exposure. While for others, there's typically some types of barriers or issues that got in the way of that recovery, which is why they kind of get stuck and develop PTSD. But
Okay.
PTSD is certainly not the only mental health issue that can come out of trauma. We know that some of the other common mental health issues that can result from trauma exposure are depression, different types of anxiety disorders like panic disorder or generalized anxiety or OCD, substance use, eating disorders. So, trauma absolutely can result in other types of mental health issues than just post traumatic stress disorder.
Okay. That's very good to
Absolutely.
know. Okay. And then I don't know, this was kind of the next question I had. Now I'm in kind of the question phase of the
Yes.
case study, but so after everything had happened my senior year or the summer before my senior year, I started dating somebody and we dated basically throughout college. I will say it wasn't the healthiest relationship in the world, but I bring this up because I don't say this in a joking manner, but my generation at least talks about trauma bonds a lot. And I don't know if that is something we've just been talking about or if trauma bonds are a real thing.
So the idea of a trauma bond, so that kind of phenomenon and that term was coined back in the early 90s. There were two clinical researchers, Dutton and Painter, and they published a journal article in 1993. And what it looked at was kind of the emotional bonds within the context of an abusive relationship between two adults. And that term, what it really refers to as in the context of that type of relationship, there sometimes can be this emotional connection that the partner ends up developing with the abuser. And there's usually, within any types of these relationships, there's usually very complicated dynamics. But when we're looking specifically at a trauma bond, there's a few key things that were identified that really kind of contribute to this. So the first is that, like we said, it is typically some type of abusive relationship where there is definite a unequal level of power between the two partners. One partner is usually typically trying to exert control over the other in some way. And that could be any range of things. It could be, physical violence, sexual violence, but it could also just as easily be emotional abuse, manipulation, coercion, things like that.
Yep.
So, in the context of this relationship, this close relationship where this type of abuse is taking place, it tends to be very cyclic. That the abuse is also kind of counterbalanced by periods where that abusive partner will be very warm, very affectionate, maybe give that other partner a lot of praise. And because of this cyclic nature, where there's like the really negative piece of it with the abuse, but then there's also these aspects that are still positive, it makes it kind of that much more difficult for the person to actually be able to sometimes leave that abuser because
Uh-huh.
they know that there are kind of these intervals where things are good and things are positive. I guess the best way to describe a trauma bond, like I said, more
Yeah.
research has been done on it. In a lot of times, at least in the context of intimate partner violence, and when we kind
Mhm.
of look at the scientific literature on that type of abuse or that type of trauma, we know that that idea of a trauma bond can sometimes be really helpful for therapists and clinicians just as a way to kind of better understand and help their client understand why it may be difficult for them to extricate themselves from that relationship. The only thing I would add to that, though, is that, when we look at intimate partner violence, the dynamics can be so incredibly complex that there can be certainly many other reasons that the partner that is being mistreated or abused may feel or be unable to leave the abusive partner, certainly
Yeah.
above just a trauma bond. So I just wanted to make sure
Yeah.
folks were definitely aware of that.
Perfect. Well, I'm glad that you talked through that because that is something I think I was also dealing with, and it wasn't like a physical thing. I mean, I don't want to get too far into it, but it basically took our last semester. We lived together, so he kind of moved out because I didn't really have it in me to make that separation. Yeah, I was going to say, I'm glad you could just kind of explain that a little more, just because I think that's something a lot of people hear about, but they hear about and use, but I think now you put more education behind it so people can thoroughly understand it.
I would just add to that because another term that I think we see a lot and it's becoming more a part of our national dialogue around trauma
Mhm,
is, so you and I just talked about the trauma bond in the context of
mhm,
an intimate relationship where one partner may be abusive towards the other. We also
mhm.
talk about trauma bonding. And that's another term that's used a lot with the idea that, oh my gosh, if we have two individuals that have both experienced trauma, they're able to kind of bond around that shared experience and the symptoms and the impact and all of that. So I also just wanted to highlight that. That's another term, very similar, but actually
Mhm.
means something very, very different than the one that you and I were speaking about in the context of an intimate relationship.
I'm really glad you added that because, yes, I've heard of that. And yeah, no, 100%.
Yes. Yes.
Okay. So, as I mentioned, that got me. I was in that relationship throughout college, but as I mentioned, I was working two jobs and going to school. Well, I
Yeah.
had things going on, but I was there, but I wasn't really there in a sense, is kind of the feeling that I had throughout that period of time. Now, kind of going back to of that season of life for me, can that be preventing solutions or preventing people from being able to be in a better spot by keeping themselves busy and not dealing with these things? Because I was so busy that like I said, I didn't have time for my thoughts or feelings. And then COVID hit, and that's where like I had no option. But I mean, a global pandemic isn't really stopping everybody or making that come apparently or abundantly clear for people. So, yeah, just wanted to get your take on that.
So the thing is, when we talk about the busyness, especially when we talk about it as a type of avoidance, yes, it absolutely can become a barrier to the person sort of seeking treatment or getting better. And so probably the easiest way to explain it is, let me back up to when we talk about that general level of trauma exposure, like 70% of US adults get exposed, but only about 6 to 7% get PTSD. When we say that the vast majority of people naturally recover from trauma, what we know is that for individuals, when individual experiences trauma, we're almost all going to have some set of those trauma reactions.
Yep.
But for the individuals who keep kind of progressing forward in life, they don't fall back on really using avoidance as a coping mechanism.
Mhm.
They reach a point where they can maybe start to share or talk about the trauma with friends or a close relative. They work hard at not just completely shutting down and kind of avoiding their thoughts or feelings around it. What we end up seeing is that they're the ones that really end up naturally recovering, because in that process of still moving forward with their life and not really shutting down and avoiding these things, they start to learn for themselves, oh my gosh, the trauma wasn't my fault. Maybe they got that feedback from a friend, maybe they got it from someone else. Somebody in a car accident, they learned that, oh my gosh, yes, I had that car accident 2 months ago, but in those 2 months since, getting back to commuting to work every day, driving around on weekends, I haven't had another accident. I'm still pretty safe. I'm still a competent driver. The avoidance is one of the things that really gets in the way of a person learning that that trauma really was an isolated event. And it's not to
Mhm.
say that a trauma could never happen again. But
Yeah.
what we do know with PTSD is what usually happens is that trauma becomes, the fear around that trauma becomes very generalized. And that's how we end up with somebody who perhaps experienced a sexual assault by a male
Mhm.
perpetrator. And then moving forward, suddenly it's, they don't trust men anymore. They won't get in relationships anymore. They start avoiding going to parties or social events. And that avoidance is the thing that really keeps them from being able to learn that that trauma really was an isolated event, and that all
Mhm.
those big beliefs we chatted about, like the world's dangerous, people aren't trustworthy, I'm
Yeah.
incompetent, those beliefs start to take hold more and more because the
Mhm.
person isn't having the opportunity to learn anything different. Does that make sense?
No, without a doubt. Yeah. So with that, because that's kind of when, COVID when it happened, I started seeking
Yeah.
therapy to try to find some better solutions since I wasn't able to keep myself so busy. I think, that was kind of, I don't want to say concludes my story, but that's kind of where I really started looking for sustainable ways and better ways to really help myself. I will be really honest. I would say probably within the last like year and a half, I think I've really started just opening myself back up to the world. Just because I think that it lingered for a long time. Self isolation in different degrees, and I don't know if it can vary with how extreme it is, but, you know, people around me, my friends, my family, they've made comments to me of just like, we're glad you're coming around more. We're glad that you're getting involved more. And it's really nice. I don't know. I was going to say it's a really good feeling, but is that normal for some of those symptoms, even though they might not be super apparent, for them to linger on for a little while?
There could be a wide range there in terms of, for an individual with PTSD, depending upon kind of just at what point they sought treatment or at what point they started doing some of their own kind of like self-help, like investigation and techniques. Yes, there still can be a range in terms of some symptoms may just impact people more than others. They may just have some symptoms that are stronger than others, so that those may take a little bit of a longer time to dissipate. I think the other thing about trauma and PTSD that's really important to keep in mind too is that environment and kind of external circumstances can have such a big impact on it also, in terms of potential triggers or anniversary dates or things like that. So yeah, I think the idea that, like you said, even though once COVID hit and I started seeking help and I could, feel myself starting to recover
Mhm.
from this, the recovery hasn't been, it wasn't like flipping a switch. It's been more kind of gradual as some symptoms subsided, sounded like maybe some hung around a little bit longer or starting to see them. That, yes, I think that absolutely can be normal as part of an individual's kind of recovery process, since a lot of people kind of recover at different rates and depending upon the treatment or the help that they were seeking.
Okay, and I do want to ask about triggers too, because with you mentioning that, is there, I don't know, a way, because you have no control over triggers, you kind of have to learn as you go, but this could be like a case by case basis of how this can help, but how can someone help like with identifying triggers and trying to navigate like, I don't want to say how they're less triggering, or like how to navigate, like how can someone navigate around triggers, or kind of what would you say about that?
So I think so the idea with a trigger, just for anybody who may not be familiar, when we talk about a trigger, is this is any type of stimulus or stimuli that is kind of associated with the trauma in some way, shape, or form.
Mhm,
So that when the person encounters the stimulus in their current day-to-day life, it normally will trigger either those unwanted kind of thoughts or memories of the trauma. It can trigger some of the same emotions that the person experienced at the time of the trauma, like fear or anxiety or helplessness. It also can sometimes even trigger physiological responses like they had at the time of the trauma, like,
mhm.
rapid heart rate, shortness of breath,
Yeah.
sweaty palms. So that's just kind of what we talk about when somebody gets triggered. It's just
Mhm,
because they've encountered something in their current environment that is linked or associated to that trauma in some way, and it's actually triggering bits of what they experienced at the time of the trauma.
mhm,
In terms of learning how to navigate them, so I would say, for some individuals, some of the triggers are very easily identifiable. And they can very clearly say, you know what, I know, like for somebody who maybe perhaps was in a really bad car accident,
mhm.
in the thunderstorm at night, they can
Yeah.
say, I know thunderstorms are a trigger. I know driving on a highway at night are a trigger.
Mhm.
People, the triggers can sometimes be a bit more subtle and a little bit harder to identify. I would say really that in the context of PTSD treatment and in the context of therapy, one of the things that we really focus on is helping an individual. I'm going to use the word desensitize. That's about the closest way I can grasp. We really want to help them start to understand that those triggers aren't dangerous, that those triggers are, very, very separate from the trauma themselves and not indicative of the trauma happening again. And so, in certain types of PTSD treatment, it's the treatment itself that really diminishes the potency of those triggers so that a person not only no longer gets triggered by these stimuli, but
Mhm.
also no longer needs to avoid them.
Okay. Perfect. Well, as we're wrapping up, I don't know, are there any maybe myths, any tips, anything over PTSD that I don't know, might be helpful? Because I feel like PTSD is something like you said, like not everybody after going through something traumatic will actually deal with PTSD, but I don't know, any tips for people that might be dealing with it, might be trying to navigate it, or kind of start their journey on finding resources to best be able to grasp what they're dealing with?
Absolutely. So I can probably lay out a couple things. I think the first thing, and I think this is not necessarily part of our national dialogue on trauma and PTSD, but it so needs to be. And
Mhm.
that's that PTSD is very treatable. We have decades of research behind some of these leading PTSD therapies. And I say this as somebody who's been doing them for over 20 years, cognitive processing therapy and prolonged exposure therapy. These are considered our first line treatments for PTSD. And what that means is research has shown that they have a better effect on reducing, if not eliminating, PTSD symptoms than medication or other types of therapy, PTSD treatments. So, for somebody who has PTSD and is seeking treatment, I would really encourage you to consider looking for a provider who offers one of these evidence-based treatments
And that's
because oh, go ahead.
CPT and PE, correct?
Yeah, those
Okay.
are those are considered our first line treatments. And the thing that's important to understand about this when we talk about evidence-based treatment or evidence-based therapy, and Alex, this holds true like not just for PTSD, this is for depression, anxiety, insomnia.
Amazing.
Therapy is a science. And a lot
Mhm,
of times that's not really recognized. When we talk
mhm,
about an evidence based treatment, it means it's a treatment that has been researched and proven to be effective. And when we say research, we mean that in the most legitimate sense. Like it has
mhm,
been done, in randomized controlled studies. It's had, objective evaluators, so there's no
mhm,
prejudice or bias. The results get published in peer-reviewed journals, meaning there's actually a committee of experts kind of kicking the tires on that study to make sure it was solidly designed and the
mhm.
results are solid. So when we talk about an evidence-based treatment, we really are talking about a treatment that is proven to be effective by research. And when a person opts or chooses to participate in one of these proven effective therapies, I mean, it's not just possible that they're going to get better, it's very probable that they're going to get better. And so I would say that's kind of the first thing to really keep in mind. If you
Mhm.
have PTSD or suspect you have PTSD and are seeking treatment, please consider an evidence-based treatment. And I can tell you one of the easiest ways to do this is just you can even Google it. If you're under another issue that you're looking
Yeah.
up in mental health and not PTSD, just Google evidence-based treatment for, and you will find what are considered the leading treatments in that particular area. So I would strongly encourage evidence-based treatment if that's something that you're wanting to or able to pursue.
Amazing.
Yeah.
Perfect. Well, and to be honest, yeah, because my next question was going to be about resources,
Yeah.
because I think that's something, that people cannot get enough of. And that is something too. I am going to put a link to Megan's information in the bio of this episode. So if you want to touch base with her, kind of see more about her as well, you can do that. Anything else before we wrap up that you might want to share with everybody?
Say, in terms of resources, the one that I really recommend the most, though I realize I'm a bit biased because I worked with them for a long time,
Yeah.
is the National Center for PTSD. Because a really common
Amazing.
misconception is because it's part of our VA, a lot
Mhm.
of people think that it's just for veterans or military, like just that
Yeah.
type of trauma and that type of PTSD, when
Mhm.
in fact it's one of our best resources for trauma survivors, period. And so they have a lot of resources out there, great information on just educational information about PTSD, really solid information on the different treatment options, including like brief videos. They've developed several apps. Some of them go with the specific treatments if you're doing the treatment, but some are just great free apps that people can use, like a mindfulness app to help deal with anxiety or stress. They developed a great COVID app during the pandemic to help with mental health symptoms. So there's just sort of a wealth of free resources open to the public through the National Center for PTSD. And their website is just www.ptsd.va.gov. And so just go to public resources and you will kind of find a wealth of resources there. And then yes, Alex, whatever you put in there for me, like I said, I'm with Upward Behavioral Health. We work really hard on our social media sites to try to really put out science-driven, accurate mental health information. These PTSD treatments are something that we offer through our practice, so you'll definitely see information about those as well. So always welcome to follow along with us also as another solid resource for mental health information.
Perfect. I will get both of those websites too, hooked up on the
Absolutely.
bio of the episode, and then also I'm gonna get with Megan about getting that PTSD website on our mental health resource tab on our website as well, just so that can be
Absolutely.
another hub for you or anybody that is listening might be needing or just wanting to look down an avenue. But Megan, thank you so much for coming on today. You have been an absolute wealth of knowledge, not just for me, but I know for everyone listening. I think everybody will be able to take something away from this.
Thank you, Alex. I so appreciate you just shedding a light on this topic, using your personal story, because I so agree with you. I think it helps so much when people can hear about it from somebody who's experienced it. It can make it so much more resonant in terms of something they can relate to or recognize. So this was great. I can't thank you enough for having me and for taking the time to focus on this issue.
Perfect. Well, and I definitely have been talking to Megan because, I mean, just from her background, she has a lot of knowledge in the mental health industry. So do not be surprised if you see her appearing on another one of our episodes. We have been talking about doing another one. So be looking out for that. And as a reminder, if you or anybody you know is in a mental health crisis, please call or text the number 9 and be kind to yourselves.